I wanted to take a few minutes tonight to talk to you about navicular disease, and specifically what we're going to talk about is what navicular disease is exactly and how it is caused. Maybe things that are wrong with the horse's foot that kind of end up getting called navicular disease even though they actually aren't. So true navicular disease is what we're going to talk about today. And basically, navicular disease is tendinitis / arthritis. It's a combination, it's a breakdown of a joint surface, and it's a combination of damage to the tendon and the fibrocartilage and some of the structures that sort of hold the area together, and then the actual joint surface itself. So if you think about an arthritis, where the joint is being damaged, the cartilage is being worn away, and then the tendons are kind of being eroded at the same time, that is navicular disease. It just happens to be occurring inside of the horse's foot, which adds a whole level of complexity that makes it a lot more confusing. So if you're not familiar with the horse's foot in general, this is a horse's foot, and inside of the foot there is a coffin bone, it's called. So that bone that's sitting inside there is the coffin bone. It's the bone that is closest to the ground when the horse is standing, of course. Now if we look at this area right in here, tucked up underneath here, there's another small bone that lies in that area called the navicular bone. And that bone sort of acts as a pulley. There's a tendon that runs down the back of the horse's leg, and it attaches on the bottom of this coffin bone way up inside here. And so the navicular bone is sitting like underneath that tendon, in between the bone and the tendon base. Now we're looking at a cross section of the hoof if you were to cut it in half. So this is that bone we were just looking at. This is the little tiny navicular bone sort of behind and underneath that coffin bone. And that tendon attaches down here, and then it runs all the way, it actually runs all the way back up the leg and attaches to a muscle in the forearm of the horse. So that being said, that area sort of all around that navicular bone is what's being damaged. This joint surface underneath here between that tendon and the bone there is what's being damaged in navicular disease. So with that, we can see inflammation of the tendon itself, damage to the actual tendon, the tendon sheath, the bursa in that area, and eventually you'll see damage to the cartilage, and it can even lead to damage to the bone itself and the actual navicular bone. Navicular disease cannot, I repeat, cannot be diagnosed only by x-ray. One of my favorite authors, James Rooney, DVM, he talks about how erroneous it is that we are running around diagnosing early stages of navicular disease by x-ray, because it cannot be adequately diagnosed, especially in the early stages, by x-ray. Advanced cases that lead to bone, like actual bony changes, can be diagnosed by x-ray, but those are the ones that are really far gone. The initial stages of navicular disease are really sort of insidious. They're hard to tell. The horses may be a little bit off one day and then maybe fine the next day, and that goes on for a while. And then usually what happens is eventually people have the vet out and they'll do a nerve block in one foot so the horse can't feel that foot, and then they're lame in the other foot. And then when they do a nerve block in the other foot, they're lame in the foot that's not blocked anymore. Navicular disease is almost always two front feet. Very few exceptions to that rule. If somebody says you have navicular disease in one front foot, a big red flag should go off, because it's almost always, there's very few exceptions to the rule of both front feet with navicular disease. Which sort of leads us into the cause. Navicular disease is caused by a few different things. The first one is very well documented, well proven genetic, specifically quarter horses with really big bodies and really small feet. And there's a lot behind that as far as to why that happens, but that is definitely a cause of navicular disease. So if you have a really big bodied quarter horse with tiny little feet, that's going to predispose them. The other causes are pretty much man-made. Navicular disease, by and large, does not happen to horses that are not ridden. So it's not something that can occur overnight in the pasture. It's a man-made thing. So usually where we see it is jumpers, horses that have done a lot of jumping over their lifetime, and horses that have done really hard work on hard ground. So mounted patrol horses, carriage horses, anybody that's sort of, traveling over paved roads for long periods of time. And it wouldn't happen overnight. It would be after months of this kind of routine of hard riding. And basically what it's doing is just wear and tear. It's friction. It's too much friction inside the foot, wearing down on that joint surface, and that's what eventually leads you to navicular disease. So I hope that helped clear up a little bit for you guys what it actually is, first of all, because it's really important to understand that, and then where it comes from. And again, you know, 1 foot overnight, those things are not navicular disease. It's both front feet. It's long periods of time. The horse gradually gets worse. It takes a while to sort of build up this wear and tear. It's not something that can happen overnight. So later I hope to do another video on some different treatment and different options and things like that for navicular disease, because I think that's another thing that we need to look at more often. But I hope that helps with some of you guys. If you have any questions, feel free to leave a comment. Thanks.